Our face is our most visible feature. The signs of facial aging can greatly affect how we feel about ourselves and how others see us. Aging in the face includes a loss of firmness, sagging tissues, and resulting expression lines and wrinkles. All of these conditions can make you appear sad and tired, even when you are not. There are many factors that contribute to the loss of a youthful appearance, including heredity, gravity, environmental conditions, and stress. A facelift, also referred to as rhinodectomy, is a surgical procedure to reduce visible signs of aging in the face and neck by repositioning the underlying musculature and tissues of the face, sometimes called the SMAS, redistributing or reducing facial fat, and reducing excess sagging skin. A facelift often can erase years from the face, creating a more youthful, rested, and vibrant appearance. The procedure addresses sagging of the mid-face and can soften the appearance of a tear trough. It also treats sagging of the area between the nose and mouth, known as nasolabial folds, and corrects fat displacement and descent that collects in pockets, exaggerating facial creases. A facelift also addresses the loss of tone in the lower face or jaw area, and can improve loose skin and excess fat deposits under the chin and jawline that give the appearance of a double chin. Through this process, the neck skin is lifted and tightened. A facelift does not, however, change your fundamental appearance and does not stop the aging process. Following a facelift, aging will continue naturally. However, as you age in the future, you should always look younger than you would if you had not undergone a facelift. Additional procedures to rejuvenate your appearance are commonly performed in conjunction with a facelift. They include a brow lift to correct a drooping and/or deeply furrowed brow, and eyelid surgery to rejuvenate the eyelids and the areas surrounding your eyes. In some cases, facial implants may be inserted at the time of a facelift to recontour the facial structure, or soft tissue augmentation using fat or fillers may be performed to restore facial fullness that has been lost with aging. Resurfacing techniques may be used to improve the surface appearance, tone, and texture of facial skin. In addition, injections of Botox, botulinum toxin type A, may be recommended prior to your facelift to help underlying muscles fully relax before repositioning and tightening. These injections may also be recommended after your surgery to help maintain results. This program presents an overview of surgical facelift or rhinodectomy. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. A facelift is best performed on adult men and women who feel that their outward facial aging no longer reflects the youth and vigor they feel physically and emotionally. Good candidates for this procedure are individuals who do not have life-threatening illnesses or medical conditions that can impair healing. A patient who smokes is at increased risk of poor healing and therefore is advised to stop smoking for several weeks before and after surgery. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how facelift surgery can enhance your appearance and improve your self-image. A consultation is designed to fully educate you regarding your facelift procedure and includes a discussion of your goals, the options available to rejuvenate your appearance, the likely outcomes of a facelift, and potential risks or complications. Your surgeon will also describe the procedure and answer your questions. During a consultation, you will be asked to share your expectations for your surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your physician of any serious illnesses or medical conditions affecting you or your family. And you must also be candid about your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. By making the decision to consult with a board-certified plastic surgeon and following your doctor's recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to surgery, it is important to discuss with your surgeon any questions and concerns you may have regarding your surgery. In addition, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo and the potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations such as testing and medications, day of surgery requirements, and specific information related to the use of anesthesia. You will also review post-operative care and follow-up. A facelift may be performed in an accredited office-based surgical facility, an accredited ambulatory surgical facility, or hospital. The decision for anesthesia will be based on the requirements of your specific procedure and considerations of patient and surgeon preference. A facelift procedure begins with an incision on either side of the face, just inside the hairline at the temples, continuing along or just inside the front of the ear and around the earlobe. The incision then follows upward behind the ear and usually continues horizontally to end in the lower scalp. Your incision may be continuous, or only certain segments of the incision pattern may be made, depending on the areas of the face to be treated, the amount of excess skin that must be reduced, and the shape of your hairline and sideburns. Through the facelift incisions, underlying facial muscle, fascia, and other tissue is repositioned to restore a more youthful, uplifted position. Fat in the face may also be repositioned, or excess fat is removed from the face and neck. A second incision under the chin may be used, if necessary, to further improve the neck. Skin is then redraped over the uplifted and rejuvenated contours, and excess skin is trimmed away. The incisions are then closed. An alternative facelift technique for individuals who don't require significant skin reduction may use shorter incisions at the temples. The mid-face may be elevated through an incision within the lower eyelids or inside the mouth, under the upper lip. An endoscope, or surgical telescope, may help your surgeon to reposition tissues and elevate mid-facial muscles. Possible complications associated with a facelift include bleeding beneath the skin called a hematoma, or correctable hair loss at the incisions. Less common are skin loss, irregular or raised scars, temporary or permanent facial nerve injury, and the potential for infection. There are risks associated with anesthesia that your surgeon will discuss with you as well. Once surgery is complete, a bandage may gently be placed around your face to minimize swelling and bruising. A thin tube may be used to drain any excess fluid that may collect under the skin. In some cases, you may wear a dressing to gently support and compress the facial contours as they heal. Often, patients are released to go home within a few hours of facelift surgery. In some cases, however, your surgeon may wish for you to stay overnight in a special recovery center or hospital for your comfort and to monitor your condition. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for facial skin following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Initial healing may include swelling, bruising, facial numbness, and discomfort that can be controlled with medication. In addition, your skin may feel tight and your facial movements restricted. These are common conditions and are temporary. Your physician will instruct you to keep your head elevated at all times until initial swelling subsides. You will be provided specific post-operative instructions, including how and when to cleanse your face and hair. Following these instructions is essential to the success of your outcome. A return to light, normal activity is usually possible within a few days of surgery. Incisions are healed within a week, at which time any sutures will be removed. You will be ready to return to work and most normal activity sometime between 2 to 4 weeks. Cosmetics can camouflage any bruising or redness that remains. Healing will continue for several weeks as swelling continues to resolve and incision lines further improve. Diligent sun protection is recommended during the healing process and is imperative if you have had skin resurfacing in conjunction with your facelift. Follow your plastic surgeon's instructions and attend follow-up visits as scheduled. It may take up to 6 months for incision lines to mature and fade. By that time, you will already be enjoying the results of your facelift. Lifelong sun protection will help to maintain your rejuvenated, more youthful appearance. You should feel revitalized by your freshened appearance, a facial appearance that reflects the energy and confidence you feel. If you are like most facelift patients, you will find that even as you continue to age, the benefits of facial rejuvenation are long-lasting. Choosing to undergo a facelift or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision. So is selecting a plastic surgeon. Not all doctors who perform plastic surgery or who use the title of plastic surgeon are board certified in plastic surgery. In order to be certified by the American Board of Plastic Surgery, a physician must graduate from an accredited medical school and then complete a minimum of 5 years of surgical training, including an accredited plastic surgery residency program. The physician must pass a comprehensive written and oral exam in order to become a board-certified plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.
Now that you've watched the American Society of Plastic Surgeons movie on facelift, I'm going to explain really the upgrades and the differences in facelifting since that style movie was developed. There are really 4 different basic styles of facelift, and the first is the oldest. The oldest style of facelift is really to elevate the skin of the face and pull it back. The problem with old style facelift is we know how aggressively skin will stretch, and so it's a very short-term result in many patients that do a skin-only facelift. Some of the facelift results that are offered as lunchtime facelifts or lifestyle lifts are done skin-only, and we know that very early on the skin from that sort of a facelift will stretch and give a patient an unacceptable result too fast for the amount of money and for the time they've taken to do that sort of a procedure. And so we really have let skin-only facelift go by the by. The other problem with skin-only facelift is it really is a type of a facelift that pulls the skin in an anterior-posterior direction and gives somebody very much a wind-swept look. And it's really not the kind of look we are looking for in facelift. Most patients that will have watched the ASPS movie on facelift will be very afraid, really, and they should be. The size of the incision, the amount of the dissection that starts way high on the head and ends way behind the ear is really a very big and open procedure. Jim Stuzen is an excellent plastic surgeon in Miami, elevates that skin, and then elevates the deeper tissue of the midface. Now we call the midface the tissue that's deep to the skin, the second layer. Well, some people could call it gristle tissue, and that would be a better way to define it. The medical term for it is the superficial musculoskeletal aponeurotic system, and the short for that is SMAS. For the rest of this discussion, we'll call that the gristle tissue of the face. And because that gristle tissue or dense tissue is attached to the neck tissue, pulling that up makes a difference in the lower face. Jim Stuzen's technique is to take the, elevate all of that skin like in the ASPS movie, and then take the side and elevate the gristle tissue off of the mid-cheek, away from the face, then pull up the lower part of the mid-face and plicate that over and sew the folded over gristle tissue to the area of the cheekbone. And that's called a SMAS plication facelift. Dan Baker, another wonderful plastic surgeon in New York City, takes out the middle part of the SMAS and takes out a segment of it, and he calls that a SMASectomy or SMAS removal. And he takes out and pulls it together, and that then by pulling the skin back also tightens the face. It wasn't until Tennard and Verpeel, two fairly bright guys in Ghent, Belgium, developed a new technique that really facelift made sense to me. The reason facelift didn't always make sense to me is people don't come into our office and say, I want my skin pulled like this, because they feel that it makes their face look distorted. They've seen too many movie stars on television who really don't like, well, people don't like the way they look. They look pulled, they look tight, they look windswept. And Tennard and Verpeel said, stop doing that. Really, stop pulling the skin backwards. Take the skin in the vertical direction. Do what people do when they go and sit in front of the mirror. When they go in front of the mirror, they don't take their neck and go back. They take their skin and they go up like this. What that does is it takes this cheek fat that used to be up here on their cheek and is now sitting down here on their nasolabial fold, making this fold look deeper. And they'll take this cheek fat that's now hanging down as a jowl. Their face used to have a vertical V shape. Now it boxes out and looks square. And so what Tennard and Verpeel said is really what you want to do is leave all of that skin attached to the gristle tissue in the lower face, not elevate all of this off, and then try and do a procedure at the level of the gristle tissue. And so this is the only example that I can think of where less truly is more. Let me explain their style of facelift, which is also known as max lift, M-A-C-S. Max stands for minimal access cranial suspension lift. Well, minimal access means it's a really short scar. So instead of a scar that starts on the side of the head, comes down along the ear, behind the tragus, this is the tragus, and extends back behind the ear, their incision starts here and ends right here. It starts in front of the sideburn, comes across with a zigzag in front of the sideburn, and ends just at the lobule, just below the ear. And so it's a very short scar. Their dissection, where they elevate the skin off of the gristle tissue, is just this distribution. They leave the neck alone. If there's excess fat in the neck, they'll liposuction it, and that's included in this procedure. Neck liposuction is a portion of max lift for those who need it. But then they leave the skin attached to the gristle tissue, and there are ligaments and dermal ligaments, and really all of the innervation is much deeper to that gristle tissue, and since you don't elevate it, the risk of nerve injury is significantly less in max lift than it is in regular facelift. Well, what they do when they have the skin elevated is they come just below the arch, this bony arch of the zygomatic bone that's your cheekbone arch, and there's a broad flat muscle and a really broad flat tendon that goes underneath that arch. So they've elevated the skin, they get down and they take a good heavy stitch and they put it right in that tendon. And that tendon isn't going anywhere, and it'll hold the stitch really good. And they'll then take a drop stitch. Now this is a single stitch, it's kind of like heavy test fishing line, and they put it in and out of this gristle tissue, in and out, and then right back up. And then when they tighten that stitch down, watch the neck, it pulls the whole neck up. Then they put in a second stitch, and the second stitch is more of a roundish stitch in front, and that pulls the jowl and the nasolabial fold fat and brings this fat right back up. Now they're pulling here, but it's pulling all the way across the midline of the neck. And so by doing that on both sides, it gives people all of this lift, and it's a vertical lift. It's not a horizontal lift. And by giving that vertical lift, all that's left really to do is without tension, without tightness, just peel off this extra skin that's bunched up right here and sew it. This operation takes about 2.5 hours to do. It has a significantly lower risk of injury to the nerve. probably 10 to 15% of patients who have a standard 4-hour facelift done, where you're dissecting off the mass tissue, the gristle tissue, and get down to the level of the nerves with a very gentle and spreading technique. In other words, spread, don't cut. And spreading the tissue, will end up with a temporary nerve got stretched nerve injury. I have never had a permanent nerve injury from a facelift. But by doing this technique and staying outside of that gristle tissue and really sewing the gristle tissue, you're so far away from the nerve that I've not even had a temporary nerve injury with this procedure. Patients have a drain that exits just below the lower part of the incision that stays in overnight. The complication of this procedure in my hands has been temporary 1 or 2 milliliter, that's 1/5 of a teaspoon of blood that will sit and pool and take 1 or 2 weeks for that to resolve, or sometimes we'll push it out when we take the drain out. I've had 0 nerve injuries. The scarring is terrific because it's hidden right in the hairline with a zigzag scar, hidden right in a fold line here behind the tragus, and stops here. This is a procedure that in Ghent, Belgium, they do in an office situation under a local anesthetic. But in Ghent, Belgium, they can give people drugs through the vein and through the in the muscle that we can't use in the United States. And so in the United States, in most people, what I do is I take patients downstairs to Theda Clark Outpatient Surgery Center and give them an IV. And through the IV, I direct the nurse to give them sedation medicine so they're under twilight. And under twilight anesthesia, I'm able to inject them with local, not much more than an ounce of total local anesthesia is used for this procedure. Do the liposuction. People tolerate this very well. They're not nauseated because they don't have an anesthetic agent. They're not nauseated because typically they don't need a significant amount of narcotic. And patients get up when this operation is done, and within half an hour of the completion of this operation, with foam rubber padding where the liposuction is done and a head wrap, they go out of this operation and walk out the door. We will typically see the patient the day after to remove those drains and to check and make sure everything has done well. They'll wear a chin strap or a dressing, usually for 3 or 4 days, so they really need to hibernate for that period of time. We do other procedures at the same time, including especially pro-fractional peeling. A facelift, when done in any of the techniques, does not deal with anything on the inside of these folds. People sometimes want to have the wrinkles dealt with a laser, or have fat injections done in the nasolabial fold, or have some of the skin that gets peeled off of here replaced into their lips to fill their lips. We'll sometimes do their eyelids, we'll sometimes do other laser peels. So depending on the amount of procedure they've had, how close we have to follow them can change. Typically though, this is 1 week out of the limelight. We've had several of our patients go out to lunch the week after this procedure with their friends or even family members and not have them know that they had surgery other than that they look different. People don't talk a lot about facial cosmetic surgery. Most of our patients that are exceedingly happy with their procedure still will not let us use their photos. We'd love to use your photos, but you will probably find that once you've had this done, people won't come up to you and say, "You look like you had a facelift." They may say, "You look terrific. What are you doing? Are you on a diet? Did you change your hair?" But people typically aren't quite as gauche as to say, "Did you have a facelift done?" And although they may notice your significant difference, they won't ask you about facelift. We'll share the photos with you from the authors of Thenard and Verpel's book, but this is something that is difficult for us to show you our results. But I will tell you, I'm very pleased with this operation. It has become my favorite facial aesthetic procedure, and we're very pleased with the results. Our patients are too.